Our story is compelling. Our story is true. Our story is Waco. It was once said that stories are the shortest distance between us and the truth. Others have tried to tell our story, but our story is unique. It must be told from the inside out. Our story is compelling. Our story is true. Our story is Waco. It was once said that stories are the shortest distance between us and the truth. Others have tried to tell our story, but our story is unique. It must be told from the inside out. Our story is compelling. Our story is true. Our story is Waco. It was once said that stories are the shortest distance between us and the truth. Others have tried to tell our story, but our story is unique. It must be told from the inside out. Our story is compelling. Our story is true. Our story is Waco. Hello, hello. This is Roy Gillis. Waco is live. How are you doing this evening? We are so excited tonight to have a discussion going. We're getting ready to talk about some things that I really think are important. They're important because they affect communities all across the board. COVID-19 is where we are. Today we are experiencing what is described as a global pandemic. We have been going through this shelter in place for almost 2 months tonight. It's affected us really in all different types of ways. Being a pastor of a church, it's affected our church, as we have not had church in the building in some time. Not only has it affected our church, but it's affected the workplace. It's affected the workplace, and many are working from home. But unfortunately, many are not working at all. They've been laid off or furloughed. I think the unemployment numbers now are up around 30 million across the country. And so we are really going through something that we have not gone through as a country in my lifetime, definitely. And so we're going to talk about this thing, COVID-19, coronavirus. And I wanted to talk about it a little bit because, for one, and there are a lot of myths, a lot of things that I hear said and I hear talked about sometimes by people that may not be professionals. And while they have an opinion, we all get a chance to have our own opinion, but we do not get a chance to have our own facts. And so tonight, here in just a few moments, I'm going to bring in a medical professional and we're going to talk about this. And so make sure you are liking and sharing this. This is Waco is Live. You can share this. I think right now we're streaming on Waco is Live on Facebook, and we are also streaming on YouTube. And make sure talk to my producer. He's got a ticker running that doesn't need to be running, and so. We're getting ready to bring in our guest tonight, and we're going to go all the way to California. Now, I saw her making a post, and what I loved about this was she came home and was doing a Facebook Live with her father. Her father is a pastor, and she's a PK. And when I saw her credentials and I saw how She spoke about what's going on and how it affected, especially the African American community. This COVID-19. I thought it would be great for us to bring her to speak to our audience in Waco, not only Waco, but in Central Texas, period. And I thought that was so important because, as I said, there's a lot of myths out there about COVID-19. And sometimes because we're not seeing it and because Waco has really been blessed and our numbers have not really spiked. I think we've only had like 4 deaths, maybe in Waco, 4 or 5 deaths. Sometimes because it's out of sight and we're not really seeing the effects of it, sometimes our behavior may indicate that we don't believe it's real or we don't know how it can affect us. So tonight we have a guest with us tonight. We have Dr. Nicole Sims. Dr. Sims, how are you doing tonight?
The opportunity.
Yes, yes. We thank God so much for you coming in tonight. As I said, I saw you on Facebook Live with your father, and he looked like a very, very proud father because his daughter is an MD, and I really enjoyed the Facebook Live that you guys did. I thought it was very informative, and I thought it really kind of spoke to our community. And I thought it would be great if we can get you on, and I'm so glad you agreed to come on short notice, all the way from California. So before we kick off, tell us a little bit about yourself.
Okay. I am a board certified internal medicine physician. I practice as a hospitalist in Southern California. I'm also associate chief of hospital medicine there as well. So I am working on the front lines. We are seeing patients, COVID patients. California, especially Southern California, we got hit kind of hard initially. And so I also sit on the COVID task force at my hospital as well.
That's awesome. One thing that I did notice was that California really kind of took action early. I thought the governor there, uh, I'm trying to remember his name now. Uh,
Newsom.
yeah, Newsom, the guy that I think he was one of the best dressed, and he's kind of like the heartthrob governor. I keep seeing his name pop up in a lot of things. But California kind of jumped in early, taking action, and I think you guys have been were on a shelter in place uh, pretty early or at
Yeah,
least
I think it's been almost 6 weeks now.
almost 6 weeks shelter in place. And so you guys took action early, and we know that I think the first cases were actually above you in Washington State,
Hmm.
but California did get active community spread, which is a term that I never thought that I would know anything about this community spread term. You guys did get community spread early, and while Dr. Sims is commenting, if you have questions for her tonight, make sure you comment uh, on the Waco is Live page, and we'll try to get those questions answered if we can. So you guys took action early. What was it about California that made you guys get into this shelter in place so early?
Well, Los Angeles actually probably got the bulk of the COVID cases. And because of how compacted and highly populated Los Angeles was, and because of LAX and the traffic in and out of LAX, they knew that they had to take action immediately. So there's a shelter in place. And then shortly after that, there were problems with PPE. We didn't have enough masks, we didn't have enough gowns. I work at two smaller hospitals a little bit outside of Los Angeles. And so we really struggled with PPE just because we were overwhelmed with the amount of cases that we were seeing, and we just really weren't prepared.
Well,
So,
tell us about. I guess starting off, tell us about. You mentioned that PPE. Now, this is another term that everybody
oh yeah.
across the country is learning about. These terms that I never heard of PPE, and all of these new terms that we're getting now. Tell us about what PPE is like where you work at. Let's start there.
So PPE stands for personal protective equipment, and that includes masks, it includes goggles, it includes gowns, gloves, and there are also special equipment that we use that filters out the air so that you aren't breathing in COVID air. And so we didn't have enough of those things. And so initially what happened was there's a panic all over about, oh, we need gloves, we need masks. So people were going and buying masks and taking them. And we had to actually close down our hospital because people were stealing in the emergency room. They were
Wow.
stealing gloves out of the emergency room,
Wow.
waiting room. And it was just that sheer panic that really kind of set things really in motion. And so there were times where, even the WHO and the CDC were making recommendations on what our level of protection should be because we were just running out of equipment. And so then, how do we see these patients and we don't have the proper gear and proper equipment?
Wow.
And so that was one of the biggest challenges that we have. But luckily, there was lots of donations from our community. There was lots of donations, from all over the country. And so now that we have more than enough that we need, but initially in those first like couple of COVID weeks, I mean, it was very terrifying because you just didn't know if you were protected enough, if what you had on was going to be enough gear to keep you safe from the virus.
Uh, and I imagine that had to be really terrifying because you're going in to actually help, but in going in to help, you don't want to become sick yourself. And from what I'm seeing, stories all over the country, doctors and nurses and frontline healthcare providers are getting sick, and having to either pull out. And I think some doctors have even succumbed and passed because of this COVID-19 epidemic. And so, what I want to talk about now is I know that it affects all people. This virus, goes across all lines. But what I'm seeing is the outcomes sometimes are different. The outcomes are different, and I don't know the exact statistics, but I know that African Americans seem to be really paying a heavier toll. We're only 13% of the population, but we're somewhere around 30% or something like that of deaths from COVID-19. So, can you speak on what are the things that is really putting us in this at-risk group?
That's a great question. I'm glad you asked because I think we talked about earlier when we first started talking about COVID, they're like, oh, Black people, we can't get COVID. We're going to
Mm-hmm.
be fine. And, that's absolutely not true. We know that um, people that have diabetes, that have high blood pressure, that are obese, that have kidney disease, those people are more susceptible to COVID-19. And just like you were saying, they did a study in the United States and they looked at all cases of COVID in the ICU. So anyone that was sick enough to be in the ICU, they looked at all the cases in the United States and did an analysis. They took away some outliers, like if you were above 90, and there are some other things that they removed. But the majority of those people had either high blood pressure, diabetes, obesity, or chronic kidney disease. And of all of the people in the United States in an ICU diagnosed with COVID, upwards of 39% of those
Wow.
were people of color.
Wow. Wow.
So more than a third of those people are people of color, even though, just like you said, we represent a minority of the population, 18% less of the
Mm-hmm.
total population in the United States. But we represent one third of the COVID patients in the United States. And that is astounding. And why is that? It's because we are more likely to suffer from high blood pressure, diabetes, obesity, and chronic kidney disease. And of those things, our diabetes is more poorly controlled. Our high blood pressure is more resistant and difficult to control. We have a higher obesity rate,
Mm-hmm.
and chronic kidney disease. There's more African American and people of color on dialysis than any other race or any other
Wow. Wow.
people in the United States.
And I didn't know that. Now, what is it about? Like, one, I think maybe, and I'm only speculating. High blood pressure, hypertension is really prevalent. My mother had hypertension. My father had hypertension. I have hypertension. So, what is it about hypertension exactly that when this disease is going through its process that is really causing? What is it about hypertension is that makes
Okay.
this go off the rails?
So let's just talk about hypertension in the African American community just for a
Hmm.
quick second.
Hmm.
We are more likely to have resistant hypertension. If you see anyone that is African American, they're at least on 2 blood pressure medications, if not more. Especially back in the slavery days, this is a good thing to have high blood pressure because you're out in the field, you weren't eating, you weren't drinking, and you needed to keep your blood pressure up. And so over the years, that probably genetic, disposition has been passed over the years. So we are more susceptible to high blood pressure just genetically. The second part of that is our diet, right? We don't, we love macaroni and
Hmm.
cheese, fried
Hmm.
chicken, and everything that's culturally ours is also risking, putting you at risk for hypertension as well. So, as far as COVID is concerned, we know that the COVID virus attaches to certain receptors.
Okay.
And those receptors are called ACE receptors. We have them primarily in our heart, in our lungs, in our kidneys, and our brains.
Okay.
Okay. And so when you have high blood pressure, your body tries to regulate your pressure by making more of these receptors available for blood pressure medication to work. Well, when COVID comes along, it sees these receptors that it loves to attach to. And because we express more of those, because we have high blood pressure, we take on more of the COVID virus. Okay. The same thing goes for people that have lung disease. Those receptors are expressed in the lungs. So when COVID sees those receptors, it's like, hey, I'm going to attach these receptors and replicate myself. That's why people with lung disease and high blood pressure and diabetes are more at risk because they express more of these receptors that the COVID loves.
Wow. Wow. See, and we think that we could get by some things, and I think I expressed to you that I remember when COVID, the whole COVID scare was happening, and I heard those myths. I heard, well, black people are not being affected by it, and and actually some of the first cases that was community spread were black people, especially those that went to the hospital, and so we know that a lot of those myths is all they were. Uh,
Mm-hmm.
has really had a big impact on us. So okay, so you got African Americans that are in this risk group. What are some things? What are some things that maybe you can do? Is there anything that we can do to mitigate? That's another term I picked up, to help mitigate this this COVID-19 thing, and how can we better protect ourselves?
I think that I'm glad that we're having this conversation because it's so important because we do need to mitigate our risk. We need to lessen our risk as much as possible because we do know that when we do get COVID, we have a higher mortality, a higher rate of death than our Caucasian counterparts. And so, the treatment is the same. The treatment is supportive. So we have to keep you from actually getting the virus. So, number one thing that you can do is wash your hands. For sure, wash your hands, wear your mask, and really, if you don't have to go anywhere, don't go. If you can shelter in place, really shelter in place. I know that I was looking at some of the numbers in actually Texas, and I think you guys have 41,000 cases in all of Texas, new cases 1,000. So you're number 9 in the United States as far as cases go,
Wow.
COVID cases. New cases are 1,000 in Texas. And a lot of those are in like Houston and Dallas. But I think Dallas is not too far from Waco, like an hour and a
Yes,
half or
90
something like that.
miles. 90
90
miles.
miles. So there's brand new cases in Dallas, brand new cases, and the number one city is actually Dallas, and Houston is closely behind Dallas. And so 90 miles is a insignificant amount of
Yeah,
distance
yeah,
when you're
yeah.
talking about a virus that's so easily spread. And so although your county has only had 94 cases and 4 deaths, I think McClellan County, Metro
McLennan
County,
County. Uh-huh.
McLennan County,
Hmm.
you've only had 94 cases, 4 deaths, and that's as of today. Um, that could easily change, especially now that things are opening up and people are moving more and traveling more. We expect to see a surge. We expect to see a second wave, but we have to see kind of what happens. We have to open up. We have to let people, if they can, go back to work and not cripple the economy. But if you are one of the people that can shelter in, continue to do so. If you're high risk, meaning you have high blood pressure, kidney disease, diabetes, obesity, you really need to protect yourself because this virus is affecting us. This virus is killing us and we are dying alone.
So you read off the numbers for McLennan County, and as I said, our numbers right now look good. Now that's based on testing, of course. That's based on testing,
Yes.
and I have a suspicion that if testing was to increase, we would find that those numbers are actually higher than what we see.
Mhm.
Tell me a little bit about what it looks like on the front lines where you are. What does it look like in these ERs and
Mhm.
and the patients? What are you dealing with? Because you're on the front line.
Mhm. I just want to say one thing quickly that we do know that the most people that are carriers of the age is between the ages of 19 and 39. So those people are the people that are asymptomatic, that may have had the virus and mild symptoms and recovered. And those are the people that are the vectors that are spreading the virus throughout, the county and the city and all of those things. So that's why it's even more important that we really protect ourselves. What we're seeing, um, people that come in, by the time they make it to the hospital, they're very sick. We are doing a lot more testing. The turnaround for testing has been a lot quicker. Before, we're waiting up to like 5 days to get
Wow.
COVID testing back. Now we can get them as quick as 6 or 7 hours. And 24 hours is the longest that we'll probably wait for a test to return.
Wow.
Um, and people come in severely short of breath. They come in with low oxygen levels. Now we're seeing different presentations of COVID. Before, we were just looking for people that were short of breath and had fever. Now we're seeing COVID causing strokes. Now
Wow.
we're seeing COVID causing cardiac arrhythmias, cardiac abnormalities, and cardiac arrest. Now we're seeing COVID causing blood clots and amputations of the extremities. And so we see just the myriad of patients that come in with this presentation, and they're very, very sick. They're very, very sick patients.
So so let's talk about those symptoms, just symptomatology, just for a minute. So if a person, because you know what happens, we play in our minds. Okay, no, I'm not sick. No, no, I just I'm feeling maybe a little bit off, and is that really a temperature? Because I've struggled with that before. Okay, now I'm at 99.9. Is that a temperature? Am I short of breath or am I just out of shape? All of those things. You think about. What are some things, some symptoms if presenting? If you being a treating physician, what would alarm you and say, "Hey, you need to come on into the ER"? What are some things that you would look for?
So the number one thing that I would look for sure, if you're shortness of breath that's not relieved with rest. So like if you're out walking or running or like putting up groceries and you're short of breath, rest. And if that doesn't improve or you're getting more and more progressively short of breath, I would seek medical attention. If you have high fever above 100, 100.2, 102, 103, high fevers like that, I would seek medical attention. If you're having chest pain, I would seek medical attention. If you're having any weakness or dizziness that is progressively getting worse, I would get medical attention. I understand I get so many calls like, I think I'm short of breath.
Mm-hmm.
I think I may have
Yeah.
COVID. My stomach hurts, and that's normal. But I would encourage people, when in doubt, get yourself checked out. There's urgent cares. I'm not sure what you have. In California, we have urgent cares
We
drive
do.
ups where you can drive up, get your temperature checked. They can check your oxygen level to see, if there's any abnormalities or anything like that.
I'm we're live with Dr. Nicole Sims, internal medicine. If you have some questions, make sure you have to inbox me because I've had a few people try to call me. No, I can't talk to you right now. Just inbox and put it on there. And even if you put it, if you watch this later, put it in there, and then maybe Dr. Sims could take a peek at that feed and come back to it. And so, okay, so we've talked about symptoms a little bit. We've talked about some of these myths. What does, because this is something that has really affected everything about our everyday lives. I said at the beginning of the broadcast, I pastor a church, and I know that your father is a pastor as well. How do how do we go back to doing things the way we did them before? For one, we always shaking hands. If you're in the church, we are high fiving. We are uh,
Tap your neighbor.
touch a neighbor, hugging. We're doing all of those things, and it's so awkward now when you talk to someone. First of all, and I want you to talk about that social distancing thing here because I heard you do an illustration before, and maybe you could do that again. How do we go back to doing things the way we used to do them? As I said, when you interact with someone now, it's kind of awkward because at the end of the interaction, this is what I found myself doing. You want to go and shake their hand, say, "Hey, good." Then you say, "Oh, no, can't shake your hand." Social distance, back up a little bit. Uh, I want to talk about the social distance and then also speak on the mask because I know Waco was watching, and some people are not gonna like it. Some people's not gonna like it. But I went out Saturday. I went out Saturday in Waco, and I went to pick up something because we pick up our groceries in the car. We go in the drive-through, and they put them in the trunk, or they bring them to the house. And when they come to our house, I tell them, "Hey, just put it on the ground, and we will get to it." So, how how important is social distancing, and how important is it to wear a mask? Because there was nobody wearing a mask, uh, not many people wearing masks when I went to the store the other day. How important is this mask and that kind of thing?
So this is how this whole conversation started with me and my dad. We were talking about what is the church's responsibility as far as COVID and how to open up safely. And so this is kind of how this whole discussion got started. He's like, "We need to go live. We need to." So then that's how we got on the internet. And so two things that we know that work. It is social distancing and wearing masks. And I gave the illustration that um, there was this cartoon, and I can't show it here, but there's a cartoon where someone is talking and this green mist is flowing from their mouth, right? And if they put on a mask, then their green mist decreases, but the person that's talking to them, their green mist is still a big cloud. So if I put on a mask and the other person puts on a mask, but we're still standing right here, it decreases our green cloud, but there's still, you know, fomites, and when we talk, there's things that are aerosolized. We spit small particles. So even though there's two people that are standing in front of each other, there's still a green cloud in between them. Now, when you put a mask on me and a mask on someone else, and you separate them 6 feet,
Hmm.
there's a small green cloud over here and a small green cloud over here, but there's nothing in between. And so you can decrease the transmission rate down to 1.5%. I mean, that's impressive. Where here, when you don't have any mask, the transmission is almost, 99%. And so that just speaks to how important the two are together, wearing a mask and socially distancing ourselves. So church is such a large part of our culture as
Yes.
African Americans, as Kojic. It's a large part of who we are, our faith. And really, I talked about even some of our mothers, that's their only social interaction during the week is really coming to church, seeing the other mothers or the friends and
Hmm.
whoever. And so I think that in this COVID era, church is not going to be as usual. It's not going to be the same. We're going to have to, toe tap, arm bump, God bless you, those kind of
Yeah.
kisses,
Yeah.
in the air with your mask on
Yeah.
until, this thing kind of settles down. And it can't be church as usual, because we know that church as usual is really kind of how Michigan kind of got in trouble, even though they were not on a, shelter at home place. We know that large gatherings and things like that,
Yeah.
because we are so loving, because we tap our neighbor, because we kiss on the cheek, we handshake, that is one of the biggest transmission rates. And so church as usual is a thing of the past right now.
That's real tough, and really, I think that's some of the struggle a lot of people are dealing with because in Texas, unlike California, here we have partially opened up, and so the only thing that I know of really that we don't have open right now are tattoo places and nightclubs, and so
Mm,
but just about everything else has opened in some respect. I think we can bring in 25%
mm.
capacity into our buildings, and so we haven't opened up our church yet, and so we're going to wait and see how things go. So I want to talk
I
about.
would really, oh,
Go ahead. I'm
I would
listening.
just really encourage any pastors that are listening here that when you do open up your church, encourage your members to use masks because it just takes one person. It really takes one person to take down a whole congregation, and you don't want to be that church on the corner that you know
No,
you don't want to be that church. And
no.
so, I know that a lot of churches are smaller, they can't socially distance themselves, but at least, you can wear a mask, a covering on your face, and try to limit your hand to hand contact with people. Wash your hands and
Yeah, I mean, it's if nothing else, it's helped us all with hygiene. I didn't know that you needed to wash your hands for 20 seconds, and they have songs that you can sing while you washing your hands now. But all of these things are important. So this is where we are right now, and I know you're not with the CDC. How long do we? How long? How long? This is this
how
is what every
long, Lord?
this is what every church person asks anyway. Lord, how long? And so, how long does something like this? Because we hear all of these things, and maybe you should explain the difference between a vaccine and a therapeutic. Is that I don't know if that's the word or not? Because I know they're coming out. They're trying to come out with therapies, and I hear that
Oh,
mentioned a lot because if you have the flu, you go get Tamiflu, the little
mhm,
things that you get to kind of help
yeah.
get through it
Mhm.
faster. What's the difference between a vaccine and maybe some of these other things that they've said they're
A
close to
treatment.
getting access to?
Okay. So the first question, how long? It really depends on us. It really depends on how vigilant we are to keep this thing from spreading. Everyone's like, oh, once we get the vaccine, we're a long ways away from getting a vaccine for COVID-19. And really, what a vaccine is basically just similar to the flu vaccine, is we're taking um, particles from COVID-19, small particles, and we're introducing them to the body so that your body can gain immunity. So that when you see COVID again, your body is like, hey, I know this. This is the COVID virus. I've seen this before and can kill it. What's happening now is the COVID, when you're infected with COVID virus, your immune system has never seen COVID-19. And so it it gets confused and it's doing all of these things. Well, by the time your body figures it out, the COVID has replicated so many times and caused so much damage and so much inflammation. That's how
Wow.
people get really, really sick. And so the vaccine is really to help us gain immunity. The things that you're talking about are treatment. So we give Tamiflu for flu treatment, but it's really not a treatment. Tamiflu really kind of helps with symptomatology. There's
Okay.
no treatment for any virus that we have.
Okay.
We don't have like a medication like an antibiotic or anything for viruses, short of like HIV, antiviral medications.
Mm-hmm.
And so um, the money is going to be really in antibody testing, and that's what they're working on. They're looking at people that have recovered from COVID and have made antibodies against the virus, and they're analyzing those antibodies to see if some type of medication can be made from those antibodies. So if someone's super sick and their body isn't mounting a response, can we use those antibodies to help their body to fight off the infection? And they're doing some of those studies now, like people that are really sick, they're getting what they call plasma injection. So they take plasma from someone that's recovered that have antibodies and they give it to the sick person. And we've seen some things that may be promising in terms of that. But right now, everything that we're doing for COVID is really supportive care. When someone comes in, they're diagnosed with COVID, we're trying to keep people off the ventilator. We're trying to give them oxygen. We're trying to give them fluids. We're trying to give them vitamin C, zinc to help stimulate their immune system so that their body can fight it off. Because right now we have no treatment for COVID. The things that
Wow.
we're doing are really they're experimental. I mean, because we haven't seen this virus before. So we're looking at things that have been done in Italy and Germany and other places and trying to implement those things based on science to see if they will work.
Well, and this is so much, and it's a place that we never thought we'd be in. Uh, you said we have no treatment. So what do because I've heard people say things like, well, hey, if you need to take deep breaths and you need to make sure you can expand your lungs, and so if you thought that you might have something, what would be some of the type of things that Dr. Sims would be trying to do to make sure that you don't end up in the ER? Because a lot of people now, and I'll say this: I had one relative that they think had COVID. They said she was a presumptive positive, and they told her to stay home and shelter in place. And unfortunately, I have an aunt right now that is 95 years old that they called us about 4 days ago, or called us last week and told us that she tested positive in a nursing home. And so,
Mm.
we're praying for her in that. But or if you thought you had it and they told you to shelter in place, I mean, it told you to quarantine yourself. Is any of that stuff true? Do I need to be taking deep breaths? And is any of that true?
So there's a couple of things, especially like young people. The truth of the matter is that people that are moderately healthy, they recover and they do well. It's the people that have these underlying conditions that don't do well. And so if I were to get COVID, I'm young, I'm healthy, I would take vitamin C, 500 milligrams twice a day, zinc, 220 milligrams daily. What we do in the hospital is we have them turn on their left side, turn on their stomach, for a couple of hours, turn on your right side so that you aren't just laying on one part of your lung, that your whole lung gets aerated and expands.
Mm-hmm.
I would be eating lots of fruits and vegetables, just kind of those supportive things that, deep breaths. I don't know if that's so helpful, but definitely we know that people tend to do better when they're laying on their stomach,
Really?
because most of your lung surface area is in the back. And so when you lay on your stomach, you allow those areas in the back to expand more and to get better oxygen exchange.
That's good information, doctor. That's good
Just
information.
little things that you can do. But again, listen, if you are severely short of breath, if you're progressively getting worse, and please seek medical advice. But if they tell you to go home and quarantine, zinc, vitamin C, water, left, right, front, center, every 2 hours.
Okay, see, I grew up in the old days where they would boil lemons and put honey and boil lemons, and before I was in the church, they used to put a little bit of brown liquor, but that's another thing.
Oh yeah, a little hot toddy. I
A
see. I
hot
know what you're
toddy.
talking about.
Yeah, that's what that was.
This
So
is another myth too, that people were saying that if you drink hot liquids, you won't get COVID. That's not true either. Like I'm just gonna drink some hot lemon water every single day and I won't get COVID. The COVID actually goes into the nasal pharyngeal area. It goes into the back of the sinuses. So
mhm,
unless you're pouring hot water in your sinuses, you can't even get that far anyway. It's not really gonna work, and you shouldn't be putting hot water in your sinuses anyway. So that's just not true. I mean, it's a good thing to do, but it's not gonna keep you from getting COVID.
and I guess I don't think I have any viewers that would do this, but I think I can safely say that drinking rubbing alcohol and
Mm,
or taking any type of disinfectant and putting it on the inside of your body doesn't work, for
it
COVID.
does not work. Please don't do that. I got
Oh,
in trouble yesterday saying things about, things from the White House. So, but none of those things, they're actually going to be very harmful. And we've actually had a couple of cases in LA where people are trying to inject, you know, things into their body and stuff like
Wow.
that. And, drinking like water with a few drops of bleach in it or a couple of, a half a cup of bleach. Please do not do any of those things. They
Wow.
will make you very sick and probably worse than maybe even COVID would do. So none of those things are helpful.
Well, Dr. Sims, I want to thank you so much for coming on air. We're getting ready to transition to another part, and I want you to stay with us. But I want to thank
Okay.
you so much for just coming and speaking. And I wanted Dr. Sims to come on to kind of give us an idea of what it looks like in another part of the country that are dealing with this. It is across the entire world. America, I think we're number one in COVID cases. I think we lead the world, and so
Yeah.
I urge you, all of our listeners, I urge you to stay at home. If you feel sick, do not go out to work, and find you a mask. Find something you can put over your face, because
Mhm.
that protects me if I come into contact with you. I understand. I know that the mask does not protect me from you. Well, it doesn't stop things from coming in, but it would stop me from giving you something. And
Mhm.
if
Mhm.
I uh, cough or sneeze or whatever, so follow the rules. Waco, Central Texas, y'all follow the rules, and we will get
It'll be
through.
over soon. It'll
We'll,
be over soon.
it'll be Dr. Sims, thank you so much again for coming by and tuning in. Remember to follow, share, and like this. This will be on Facebook. It will be on YouTube, and we'll probably rebroadcast it many times because we want you to hear it. This is Roy Gillis. Waco is live, and we are signing off.
Thanks, Pastor.